Thank you, Crystal. I'm sure I've never been greeted so many times in a day, but otherwise, let me say good afternoon as well. Thank you. Yeah, so to get into our research that we conducted, a brief background, where we work. Okay, so we are currently working in East Africa, West Africa, and Southern Africa. And the research that you're going to hear today is primarily focused on the research that we did in Ivory Coast, in West Africa. So the research is called Community-Led Monitoring, which is a paper-funded project for 12 months and is being implemented in Abidjan, Ivory Coast. The aim of the research really was to understand the comprehensive HIV knowledge for young people and also explore concepts of gender and its possible impact on young people's sexual behaviors. So the research targeted young people between the age of 10 to 18, and also, like I said, exploring the issues around gender and the place where it was conducted. As TACO, what do we do? So we use football as a vehicle for social change in engaging young people in their sexual health in a way that they will remember, enjoy, and also understand. So a simple equation, as you can see. Okay. So our findings from the actual research, from the implementation of the project, initially we trained 24 young leaders as peer coaches, who then reached out to 620 adolescents. Of that number, 31% were female. We were able to deliver 271 HIV football sessions, and you can see from the graph the improvement in knowledge from baseline to session 10, and also respectively to say after session 17. So 70% increase and also 83% increase in knowledge. So the data that we are going to present to you, with the help of a PhD student, we developed and piloted a new qualitative research in which we trained community coaches who live in Abidjan and understand the issues that affect them around HIV. The coaches then conducted a semi-structured interview with their young players, and in this particular research, we use what we call research by coach. After the research was conducted, I think we also were able to use what we call a story completion method. So the story completion method is a method recognized in research and is particularly useful in drawing out norms and values around social phenomena, especially if it's too sensitive a topic to ask direct questions. So, for example, from this drawing, you can see that it's a discussion, and we pick points or questions that focus on words, thoughts, and interactions. Some of the questions that we ask in this research to draw out these thoughts and reactions were highlighted in green. Okay. We believe that M&E should not only gather information about a program, but it should also be an opportunity to understand perceptions perceptions of coaches and also the program recipients in a quest for local relevance, sustainability, and community ownership. So this image that you're seeing summarizes some of the steps that we use. The steps might vary depending on what we want the outcome to be, but usually these are the steps that we are going to take in the research. So some of the results from the research was concepts such as Mogapon, that they exist in Ivory Coast. So Mogapon is a Ivorian jargon which refers to a group of young people that have multiple sexual partners and use lies to control their partners. And after the first sexual encounter, they leave these partners. So we discovered that those things exist. Also, the second outcome or finding was that the motivation for these young people, sexual practices, is to stand out amongst their peers and also maintain that status among their peers. The other motive, or there was also a clear comparison made by respondents between masculinity and mogapo and sexual domination, and also encourage that sexual domination and violence was encouraged amongst these groups. Okay. The other results that we found was that mogampons, or these young people that belong in these groups, do not use condoms and also are afraid to access HIV services, which is quite alarming for young people to engage in. So in winding up, we are saying football drills with inbuilt HIV messaging have proven effective in increasing adolescents' comprehensive HIV knowledge. And we're also saying from the learning from the RBC study, it has led us to focus on the next steps or intervention on addressing issues of toxic masculinity and also these groups like Mogampon, and also target adolescent HIV prevention in Ivory Coast. So, like I said, this project was a 12-month project, and we've submitted an extension, and hopefully we can keep learning from this and see how best we can do targeted programming for these young people. So the RBC study focuses, or just helps us to understand the value of what we can get out of the programming. Thank you so much.